Welcome to Medical Therapeutic Yoga with Dr. Ginger Garner. We're going to be doing a femoral version screen or Craig test, typically done in physio or physical therapy. First, to get started, you'll want a plinth or a yoga mat, and you'll want to have the patient lying prone. We are going to be measuring the angle of the, as seen from the greater trochanter here, of the femoral neck against the distal femoral condyles. So using the greater trochanter as our home base, we'll be pulling an angle between those two landmarks. You want to flex the knee only to the point where the psoas or the hip flexor group isn't on tension, which means the pelvis doesn't rise. Then take the first two fingers, or what I call a two-finger approach, to line up the greater trochanter between the fingers. Rotate the hip internally and externally until the most prominent position is found. That means the greater trochanter is most lateral. This is going to be the angle, or create the angle, you're going to measure. Hold the leg at that point and take the goniometer, or a digital goniometer that I'll use in a moment, and line it up vertically along the tibia. That will be your femoral version angle. Or you can use a digital goniometer along the vertical axis of the tibia, which is a trochanteric prominence angle test. Or you can use the distal femoral condyles, which is the TCAT, the transcondylar angle test. So you can use the TCAT, the one I'm demonstrating now, or the previous one, the TPAT. I'll demonstrate this again. You can see that the angle is greater than the norm. We'll repeat it one more time for accuracy. Flexing the knee up to 90 degrees, finding the most lateral position of the greater trochanter. Lining up the goniometer on the vertical axis of the tibia, finding the angle, or doing the same along the femoral condyles. And again, we find the same angle, which is outside the range of normal femoral anteversion of 8 to 15 degrees. Now we'll repeat on the opposite side. It's important to measure bilaterally. Both sides of the pelvis and the hip joint won't necessarily be identical. As we measure again, we compare with the opposite side. You'll notice that I will pull the angle several times to make sure that I'm, number one, holding the goniometer vertical, and number two, maintaining the same angle, because you have to both support the leg with the body at the same time you're trying to take that measurement. The TPAT test first, or along the condyles for the TCAT variation. This test helps determine functional limits for range of motion in yoga posture performance and sport in general, especially since many yoga postures use or encourage end-raned hip external rotation. Those with angles greater than 15 degrees may have anatomically limited external rotation, and those with less than 8 to 15 degrees would be considered to have femoral retroversion, which could limit osteokinematic internal range of motion. Thank you for joining me.